These videos are meant to be used in conjunction with formal in-person photographer training and should not be used as a primary resource in the training of proper use of retinal cameras. This video may be used freely for nonprofit educational purposes with the expressed acknowledgement of the University of California, Berkeley. Use for any other purpose requires written consent from the UC Berkeley Optometric Eye Center. This video is copyrighted by the UC Berkeley School of Optometry 2012. In this video, we will show you methods on how to modify your photography technique to maximize image quality and minimize small pupil artifacts. When the consultant looks at a case, there are 3 required elements that must be present in at least one of the 3 internal photographs for each eye. 50% of the total retinal area must be visible and in adequate focus. The optic nerve also must be visible and adequately focused in at least one image, which is usually attainable. The most difficult element to obtain is ensuring that the macula is adequately illuminated. This is the most common place for the shadow to appear. Keep in mind that at least one image per eye has to have the macula sufficiently illuminated. To learn how to review photos before the patient leaves, refer to the photo review during patient encounter video. This is an example of a case where the small pupil causes a shadow over the macula. We can clearly see from the external photo that the patient's pupil is rather small. Internal field 1 exhibits the small pupil artifact, obscuring the macula. Internal field 2 also has the shadow, so none of the photos have met the macula requirement. As you can see, however, internal field 3 has captured the macula with adequate illumination. Now we will go through several techniques to avoid small pupil artifacts from obscuring key portions of the photos. In this example, the patient's pupil is small and therefore shadows interfere with viewing the retina on the monitor. You can see, however, that the shadows move around with slight movements of the camera. Using slight movements to move the camera up and down, in and out, or left and right, move the shadow around until it no longer obscures the macula in your view in the monitor. If the shadow is no longer obscuring your view of the macula in the monitor when you press the shutter button, then the resulting photo should have the macula adequately illuminated. Be aware that this technique takes time and experience to master. As you can see from the resulting photo, although there are artifacts at the edge of the photo, we have successfully captured the macula. It is important to note that the position of the shadow in a monitor just prior to snapping the photo will be the position of the shadow in the resulting photo. Our recommendation is to leave the small pupil setting in the off position unless it is necessary to avoid small pupil artifacts. If, however, the small pupil artifacts are interfering with retinal photography, the small pupil setting can be utilized to minimize shadows obscuring key portions of the photos. In this example, the small pupil shadow can be seen in the monitor obscuring the area over the macula. As demonstrated in the previous technique, you can see the shadow moving around with very slight adjustments by the camera operator. In this example, we turn the small pupil knob to the on position. Note that the central shadow immediately disappears. However, you may still notice a shadow over the macula. If this is the case, utilize the techniques shown earlier in the video to ensure that there is no shadow over the macula when you press the shutter button. Although the artifacts that we have discussed in the video thus far are not directly caused by insufficient flash brightness, it is sometimes helpful to increase the flash setting in conjunction with the techniques previously discussed to achieve adequate illumination. Be aware, however, that increasing the flash brightness will cause the pupil to constrict more, and therefore you would have to wait longer in between photos for the pupils to redilate. Please note that this does not apply if you have dilated your patient. Here are some other solutions to avoid small pupil artifacts. Make sure you are working in an environment that is as close to pitch black as you can manage. Wait sufficient time between photos to allow the patient's pupils to redilate. We recommend at least 60 seconds between each photo and that you use a watch or a cell phone to time yourself. The best thing to do is have them close their eyes until you are ready to take the next image. Ask the patient to wiggle their toes, which may seem silly, but it does help dilate the pupil a little. Another trick is to ask the patient what they will be doing later in the day, for instance, what they plan to make for dinner. This tends to cause the patient to lose focus, which can make the pupil dilate as well. Have the patient look through their fixation light as if they are looking at the wall behind you. Lastly, dilating your patient is the best way to improve picture quality, speed up photography because you don't have to wait for the pupils to redilate between photos, and avoid small pupil artifacts. To illustrate the difference between dilated photography and undilated photography, here are two example cases. The case on the top is from a patient that has not been dilated. Note that the photos are dark and there is no photo of the left eye that adequately illuminates the macula. This set of photos would be graded as insufficient for full interpretation by the consultant and would likely have to come back for re-imaging or be sent for a dilated eye exam. The patient in the case on the bottom was dilated. As you can see, all of the images are free of shadows and artifacts and are well illuminated. We strongly encourage you to start dilating your patients, and a sample dilation protocol can be found in the photographer's manual at www.ipax.com. Please note, however, that because diagnostic pharmaceutical agents are being administered to the patient, each clinic must internally evaluate and approve their own dilation protocol. If you have any questions about any of the procedures shown in this video, please contact UC Berkeley Digital Health or IPAX.